Hello, my name is Dr. Marty Martin, and I'm a faculty member at DePaul University in the city of Chicago, where I both direct and teach in the health sector management curriculum. So let me tell you a little bit about the topic for today. The topic is very close to my heart. It's both community health as well as population health. And what I seek to do with this particular focal point in terms of the presentation today is to show you how population health must be built on a foundation or bedrock of community health. So we're at a time right now in healthcare where we still have fee-for-service medicine. We also are gradually beginning to have more at-risk contracts, whether it's global bundled payment, whether it's an ACO. And if you have an at-risk contract, it behooves you to really make sure that you manage the health of a population that might be attributed to you. But that's different from community health. So community health is about place, geography, where people live. Population health really is the assignment of individual patients, and in the aggregate, they add up to a population. The two are not mutually exclusive, they come together. So let's get on the same page with some definitions. First, population health, if you note, is the health outcomes of a group of individuals, keyword there is individuals, including the distribution for such outcomes within the group. Now let's look at a definition for health, and this comes from the World Health Organization, a state of complete physical, mental, and social well-being, and not merely the absence of disease. So where community health comes into play, it's both about embracing this definition of health, well-being, as well as embracing the definition of population health. So if you note, there are populations in the community. So those populations in the community, whether it's a city, a town, a county, a nation, a region, a continent, the focal point is both promotion and prevention. Now let's distinguish that from populations under care. So you may have a primary market, secondary market, tertiary market, or you may have members that are enrolled in your health plan. There you have a population under care. So there you want to prevent, you want to screen, and you want to manage. Next you have individuals under care. So for individuals you want to diagnose, you want to treat, you want to rehabilitate, and you want to manage. I think where we are in healthcare today is we do a very good job at individuals under care, by and large. We're beginning to try to figure out how we actually handle populations under care. Health insurance companies and health plans probably do a bit better job, and we're really trying to figure out how do you actually address services for populations within the community. Traditionally, public health has done a fantastic job at that. So if you're putting together an ACO, you need all three, not 2 out of 3. So what is population health management? So is this population health management an individual that's engaging in physical activity? No. Is this population health management someone reading the newspaper, a couple there dancing, someone eating or reflecting, if you will, a birthday celebration, someone getting their blood pressure taken, someone studying, and someone cooking? And even if you note on the bottom there, just an example about an ACO. So is this population health management? Yeah, yes, to a degree. But is this real population health management or community health? So if you will note, I've added places or sites, factories, schools, places of worship. So when you look at place, and you add place to a provider organization, you add place to the health plan, you add place to individuals, now you're talking about community health. That's community health. So it's not either or, it's both and. You still need the provider organization, you still need a reimbursement organization, you still need a care delivery organization, and you need fantastic public health or community health interventions as well. Let's take a look at this from a continuum. So if you note there, you see management of utilization going all the way to population management, and sitting there in the middle is value-based reimbursement. So as you know, we're moving gradually towards population management. We've always had disease management since the first era of managed care. But what is the focal point of that disease management? The focal point is we identify some frequent flyers, some high-risk utilizers, and then we do intensive case management, typically done by a nurse, increasingly now even some pharmacists. And what we seek to do is to make sure that that particular individual appropriately utilizes health care given their diagnosis. That needs to continue. And with the Affordable Care Act, some preventive screening is now not only mandated, but also too at no cost to the individual. So what that does is lower any financial burden. And health information exchanges, they're set up such that provider organizations can begin to share data even if one organization is running Cerner, the other one's running McKesson, and the other one's running Epic. But what's missing from that population management category is community health. And again, the thesis of this particular presentation is if you really want to move forward with population management, you must consider community health management. So here's a conceptual framework as it relates to population health management. And if you'll note, you have the care continuum that's there. You also note a number of program outcomes on the bottom, but I want to direct your attention to basically two parts of that slide. So one are community resources. So here you can partner with social services. You can partner with government services. You can partner with non-governmental organizations. You can partner with philanthropic organizations, as well as you will note organizational innovations. That could be religious institutions, could be workplaces, could be school settings. So it's extremely important when you begin to manage the health of the population is that you partner with the community. Now this one's a bit busy, but I'm going to walk through it pretty carefully to really drive home the importance. If you want to improve individual health outcomes, as well as improve population health outcomes, you fundamentally have to address place, culture, and environment. Why? If you drop down to the bottom there and you look at some of the causes of both mortality and morbidity, you'll note the physical environment accounts for 10%. And I'll come back to that a bit later. You also note that social and economic factors account for 40%. Then we have clinical care at 20%, health behaviors at 30%. So does your population health management strategy address the social and economic factors at 40%? Does it address the physical environment at 10%? And if you only address the 50% and not that 50%, you're only halfway there. So let's look at what constitutes a healthy community. So if you'll note there in black, I have some characteristics of an unhealthy community, and in blue, some characteristics of a healthy community, to give you a sense of comparison and contrasting, if you will. So really, when you're engaged in a population health management program that sits on a foundation of community health, you're striving to move towards a healthy community. And you have to do that through partnerships. And your neighborhood will affect the health. So again, you see some attributes there of what constitutes a healthy community. Now let's frame this using some public health language. So is an unhealthy community a risk factor for the manifestation of disease, illness, disability? Likewise, is a healthy community a protective factor to prevent, or if someone does indeed manifest an illness, perhaps shorten the length of time that they're in treatment, better able to manage, really have some resiliency post-rehabilitation? I would strongly encourage you within your population health management initiatives that you have a discussion and a plan and you resource healthy communities. So what organizations address these issues? It's social services, it's government, it's religious organizations, it's the public health community, it's law enforcement, it's the Chamber of Commerce, it's employers. So if you're thinking there as a healthcare executive is, you know what, that's not our mandate. You're right. It's not your mandate. But whether you get shared savings, whether you receive a financial incentive or disincentive, you're going to have to play in the community health landscape. And if you don't play in the community health landscape, it's going to have a negative impact on your scores as well as your margins. So think about it from that point of view. You don't have to do everything to have an impact, but you must collaborate, you must partner, and you must have a good plan. So let me kind of walk you through about a neighborhood where I grew up in the city. And that city, for those who are not familiar, is Washington, D.C. So if you will note there in the green, you see 75. I actually grew up in a neighborhood that's on the other side of that river, and you note that's 72, where the actual number is 68. So that's expected life expectancy within certain neighborhoods within one city, the District of Columbia, which is a relatively small city, or your nation's capital. So if you note in the red there, you see 81.3 years as the average life expectancy, a relatively affluent part of Washington, D.C. Then you see 72, nearly 10-year difference in the same city. So when you think about community health, when you think about place, think about zip code. Think about neighborhood. Think about block. It's extremely important because if you're going to have an impact and you have individuals that live in the 75-year-old community, 72-year-old community, or 81.3-year-old community, you're going to have to tailor your interventions. You're going to have to segment your market. We're used to segmenting markets in healthcare, but do you segment based upon zip code and neighborhood as it relates to health status? If you don't worry about it. Most healthcare organizations do not, but begin now. So some might be saying as you're listening to this presentation is, hey Marty, what role does individual responsibility play? Well, clearly, individuals have to take responsibility for their health, but we do not live in isolation. We are embedded within a context. That context has pollution or not. That context has great schools or not. That context has a trauma center that's close by or not. That context has living wage jobs or not. That context has a lot of pollution or not. So it's not just about the individual, it's about the individual embedded in a particular community. So we have to look at this from a systems point of view and a holistic point of view. So let's distinguish a bit between population health management and the more public health focus. So if you will note, public health is more tied to government, true. Public health does not, however, exclude the healthcare delivery system. So that's false. It should be more closely integrated. Now on the population health management side, it is true, it's less tied to government, but maybe a little bit more government collaboration may behoove us within the healthcare delivery system, and it does certainly include the healthcare delivery system, but it must be broader than the healthcare delivery system. So now let's begin to look at shared roles and responsibilities and accountabilities. So before I move on to that next module within this particular dialogue, I just want to sum up this module with this thought and conclusion. Please, please be sure that your population health initiatives are based upon a strong foundation of community health, because individuals are embedded in workplaces, schools, religious organizations, communities, and families. And if you really want to have an impact on individual health outcomes, as well as an impact on population health outcomes, and even your organizational outcomes, you're going to have to address community health, but you don't have to do it alone.